Good evening, Patrick here from Complete Health, and I just wanted to jump on and ask a really simple question for those people who self-manage or try to self-manage all of their own healthcare. How do you measure it, and how do you know if you're actually getting the result that you really are intending to get? So I had a gentleman come in this week, really interesting guy. He's seen chiropractors in the past and problems have been identified for him, which he has been working on. And interestingly, when I did my assessment with him, there were quite a lot of issues actually going on. And despite the fact that he had been working on his own problems for a significant period of time, there were still other things happening or problems starting to occur. So the question is, how was he actually measuring things? And when I asked him the question, I said, okay, I really appreciate, you're a very motivated individual, you're doing some great work. Some of the stuff that you've spoken to me, it shows you've done your research, but how are you actually measuring this? And he didn't have an answer. He said, well, I'm not. And I said, okay, so how do you know if you're improving or not? And he says, I don't. So this is a really interesting thing. You see this a lot with people that go into the gym, or where people may be trying to improve on their health, or in a number of different areas. But if you're not actually measuring the result, you're not measuring the change over time, how do you actually know if you're improving? Let's just use a couple of examples. So say, for example, if you're going to the gym, you may start by picking up a 15 kilo dumbbell, but later down the line, you may be picking up a 20 kilo dumbbell. Now that's a measurable difference, and you can record and you can track that in the same sense that you can start to track, say, for example, your water intake by how many bottles of water you are drinking a day. And you can start to say, okay, so my bottle is 750 milliliters. I am drinking 4 bottles a day, for example. So I'm drinking 3 liters a day. But how do you actually track stuff like your health? So when it comes to stuff like lower back issues or postural issues or changes in the way that people do their mechanics, how are you personally going to measure this as a self-managed individual? Now, this is one of the reasons why personally, I will never do my own management for my own spinal care. Why? Because I do not believe that I'm particularly good at measuring my own success rate. But if you are going to self-manage, you have to make sure you have a track record or results record system that's actually going to tell you whether you're improving. So say, for example, if you've got low back pain, as your pain starts to improve, how are you going to actually measure it other than just how you feel? Because ironically, I had to learn this lesson a very hard way because my mum decided not to measure her health properly. And as a result, she went by how she felt. And it meant that her bowel cancer was spotted way too late. And as a result, it meant that she did not get the care in time. And this essentially meant that she didn't make it through. So if you're going to measure your health, how are you measuring it? So say, for example, with low back pain, there are some really good indicators as to whether you're going to improve or not. Stuff like your range of motion, your core line stability, balance and coordination, among other things. But you need to have a start point, then a process, and then an end outcome. So for me, like when I take a patient through their patient journey, we'll always start off with a postural alignment, and then we'll have a look at what they look like before and after. We can even use tests like coordination and balance. So I'll get someone to balance on one leg with their eyes closed for 30 seconds to see how well that person can balance. Now, the thing is, I know if someone cannot pass those tests, there is a much higher risk that they're going to be injured or going to have an active problem, or they're going to have a problem in the future that they do not know about yet. And what we do is we will put a process in place and then we will remeasure it down the line. So I had this guy who came in with a problem, and he was complaining of postural problems and kinks in his neck. And, he could feel this kink in his neck, and he'd been working on it and it was improving, but he doesn't actually know how it was improving. And so what we've done is we've taken a digital analysis, we've put the line analysis on there. So we're going to actually be able to say, well, look, this is where you are. This is where you need to go, and this is going to be the process that we're going to have to travel through in order to get you there. And this is the steps that we're going to have to take, and we can measure it each way as we're going through. So like I say, if you're going to take self-management as an option, always have a measure. And I try to give this with my patients outside of the office. So I will give them exercises, and it's one of the hardest things as chiropractors to try and get patients to do, because as soon as someone starts feeling better, they stop doing the exercise. And that is completely the point of the actual exercises. We do not want you to do them until you get out of pain. We want to get you to do them consistently until we can see a measurable difference. There's a big difference between doing something to get out of pain, and there's a big difference between getting to the point where actually you're stable and you're solidified and your posture and your alignment is measurably different. And we want to see those measurable differences. We want to see that those people have recorded and they've actually gone through a process where they have seen a result and change, but we've recorded it. So like I say, if you haven't got any results recorded yet, find something that you can record and work upon it and see if it makes a difference. Because like I say, as soon as you have something that you're recording, it will increase your accountability. But one more tip, if you want to increase that accountability, report those results to someone else who is helping you through the process. So say, for example, if you want to improve in the gym, record all your results and your stats, but make sure you have a training partner or someone that's going through your results and seeing how well you've done. Because as soon as you actually have a result that you're recording and then you're reporting upon it, you will see that result fly even faster. Trust me, I know, I've done it. Every time I ever had to record results and send them off to my coaches, all of a sudden I was like, oh crap, I haven't actually lifted the weights, or I haven't done the run, or I haven't done the stretching in the way that I've done, and I'm only recording 2 or 3 sessions of stretching, and they wanted me to do 4 or 5. All of a sudden I'm actually trying to make up the sessions at the end of the week, so I wasn't letting anybody down. That's how working with a practitioner works better than trying to do it on your own, because you're constantly trying to make sure that you're succeeding for that person so you don't let someone down as well. Just a few tips. If you're not doing them, maybe it's time to take time to actually find someone that will help you through this process. Patrick here from Complete Health. Until tomorrow, you take care.